A motorcycle accident nearly took the life of John Folks. After several surgeries that saved his life, he was left with excruciating back pain and leg pain. The only thing that helped him cope were opioids. In January, his physician told him that he could no longer prescribe him opioids. For a month, John went with no effective treatment. The pain got so bad that he sat his wife down and told her he was going to kill himself. He even discussed with her what gun he would use. Now, fortunately, John found a physician that would prescribe him his medicine, but he still worries that it could happen again. We need to help patients like John Folk. As we rein back the opioids in the United States, one thing is becoming more and more clear. An underlying cause is chronic pain. We have 100 million Americans in the United States today that suffer from chronic pain. 1 in every 3 of us in this room. The population the size of California, population the size of Texas, Florida, Illinois, combined. It costs this country $300 billion a year. That's $1,000 for every single American. And it costs more than cancer, more than diabetes, more than heart conditions combined. Our challenge in the United States is to relieve these patients of their pain with more effective and less addictive treatments, giving them to the right patient at the right time. Now, fortunately, there are some things coming forward, new technologies, specifically in digital and in pharmaceutical. So first, let me talk a little bit about digital. We can use digital technology in the future to actually diagnose pain. We do it already today. For example, in Alzheimer's disease, where 20% of patients are misdiagnosed initially. Lilly brought forward in 2012 and introduced brain imagery that can diagnose Alzheimer's more quickly and more accurately, hopefully leading us to new medicines that will stop the progression. Also, Apple and Google, they have glucose sensors that they can put in contact lenses and watches. Although still in development and maybe years away, diabetic patients can look forward to not having to prick their fingers multiple times a day to check their blood glucose. And today, we already have artificial intelligence that can actually interpret radiological scans and can diagnose dermatological conditions just as well as human physicians. So when we look at pain, we will be able to diagnose pain by looking at patterns in sleep, looking at movement patterns, and looking at heart rates with input from patients on what their pain level is. If you look at what we can do with digital technology in pain, we can also look at the acute setting. In the hospital, when do you discharge a patient? If we can actually measure when they're at an acceptable level of pain management, that would be our trigger. We could actually look at using digital technology in follow-up. Patients are prescribed a week of opioids. Before they get more, perhaps they don't need more if they are already at that acceptable level. We can also use digital technology in the prevention of pain. For example, if you took a look at the measurements I just discussed before, and you could create an algorithm predicting migraines before they actually happen, measuring the same things, heart rate, movement, and sleep disorders, or sleep movements. If you did that then, and you're a migraine patient, for example, you could actually put the algorithm in that when that pre-diagnostic comes that you're about to get a migraine, you send a text to dad and the kids, you order a pizza digitally to be delivered that night. If you have smart apps in your house, you actually can close the window shades, dim the lights, and make sure there's no noise. These technologies can really be killer apps. And if you combine them with pharmaceutical technology, I'd actually say that they're painkiller apps. I'm excited because although today, in over 20 years, we have not had new innovation in the pain space. In fact, today, opioids are the most effective for acute pain relief, but they're not meant for chronic pain. Antidepressants aren't very effective in helping in pain, and patients who have migraine fail triptans and Botox. But now a new innovation of a class called CGRPs is hitting the market in multiple companies. These will help prevent migraines and are being studied for oral use for acute migraine. There's also in late-stage development non-opioid medicine that can treat osteoarthritis pain, chronic lower back pain, and cancer pain. So combining digital and pharmaceutical technology, we can achieve a lot. But we must first make sure patients can access these treatments. We have to reimburse, not just for the medicine, not just for digital, but the combination of the two. And payers need to see value. We have some policy hurdles that need to be removed, like the anti-kickback statute. Payers need to be able to measure what treatments are working. What if that $300 billion that we're spending is going for treatments that work, that we should keep doing, and what can we stop doing? And we actually also need to have a new mindset. Many people think that pain is just in their head. Even loved ones sometimes think that. And it's not. And it's not just a symptom of another disease. I know the healthcare community doesn't consider chronic pain a diagnosis, but maybe they should, because the patients do. If we treated chronic pain like a disease, we could do so much more. Patients like Lilenya Janke, she's 23 years old. She's in college and has suffered from migraines since she was 14 years old. She's been through so many medicines. She's been through antidepressants, triptans. She's even tried acupuncture and the massage. Nothing worked for her. They were so severe, she actually put her head under ice-cold water when she would get a migraine and hold her breath for as long as she could until it passed. And if she was out and about, she would crawl into the back seat of her car, putting her blanket over her head in the dark, keeping out all the sound. Now, fortunately, she enrolled in a clinical trial for CGRPs, and she's much able to cope better with her pain. She's graduating college, and she's going on to graduate school. Now, when you look at the combination of digital and pharmaceutical technology, we can achieve so much more for so many patients. Because remember, we're afflicted in this country with chronic pain, and the remedy is in our hands. Thank you.